all your life, you will never age, you will stay always beautiful, but I'm not sure you'll be happy. But the problem is not only gravity. We lose a lot of fat when we get older. It's not only lose fat. We lose fat, but actually the fat is moving. So my definition of aging is a fat facial delocalization. I mean, you lose fat, and because of gravity, some fat is going down. So that means if you want to create beauty, you have to fix the problem. Shed a light, I will show you before. There is some doctor who was not here before. Some doctor who just arrived now. Because something is the same slide, I go fast, goes fast. I think I show you already this one, no? When you are a baby, you have no, it's only light because you have no hole. So I showed you that before, not to insist. And what is interesting is David Klein, his plastic surgeon, SPS 2005, said, we lose also the bone. We have also atrophy of the bone. That means the orbital bone is going bigger. That one, when you are too old, the eyes looks very small. But the size of the eyes don't change. The cavity is bigger. And because the cavity is bigger, the eye looks smaller. I speak about anatomy of the area and how to avoid to have some problem. The surface of the face is very important, the eyebrow. The position of the eyebrow is so important. But what you have to understand is that the support of the eyebrow is the temporal area. That means when you want to lift the top of the eyebrow, of course you can use the Botox in the orbicularis oculi, you can inject, of course, but it's not enough. If the patient has a very big hole in the temporal area, the fat of the temporal area is the support of the eyebrow. That means if you want to lift the eyebrow, first you have to feel the temporal area. And after you can inject Botox in the orbicularis oculi. And moreover, what's important when you look at your patient, on the front, if you don't see the top of the eyebrow, like here, if you don't see that, that means the patient has lost a lot of volume. And that means you are absolutely to feel the temporal area before to do anything else. You can see here the patient in 1984 and 2014, how it changed completely because she has really fat and sagging of the skin. To feel the temporal area, before I show you for the forehead, but for the front, you can inject, like I showed you before, you can inject hyaluronic acid or fat. You can use both. You can use a cannula. I think I showed you the video before. I use only the cannula 22 gauge, or sometimes 25, but I prefer 22 because it's bigger. And on the patient, exactly the same. When you make dissection of the temporal area, you have the skin, after you have the fatty layer, after you have the aponeurosis, after you have the temporalis muscles, and after you have the bone. You have all this layer here. And the temporal artery is located in the fatty layer, like I told you before. That means immediately after the skin. That's why I recommend you to inject deeply this area. But some guys, some doctors said, how you make sure you are deep? There is a tip, I'll give you a tip to make sure you are deep. When you use the cannula, you have to screw the cannula like this. If you screw the cannula, you are obliged to be deep. If you want to be more superficial, subcutaneous, you can inject directly the cannula, you push directly, and you are not deep. But if you screw the cannula, 100% you are deep. So it's very safe. So every time I introduce my cannula, I do the screw technique in order to make sure I am deep. Because I don't want to touch the temporal artery. Again here, you are not the pointer, please. You have the pointer? Yes. So, like you know, it's artery is very important. This slide, you have the temporal area. She has two branches, the frontal and the parietal branch. And the frontal branch is connected with the supraorbital artery and supratrochlear artery and with the ophthalmic artery. So I mean, if you use a needle, thank you. If you use a needle to inject this part, if you introduce the product, the temporal artery here, the product could pass here to follow this artery until the supraorbital, and unfortunately, you have here the ophthalmic artery. So if you want to use a needle here, like I told you before, you have to introduce the needle perpendicular to the bone, to the skin. You touch the bone, and after touching the bone, you can inject. But 99% I use the cannula. If the temporal area is a small area, it's good to use the needle because one shoot is done. But it's a big area, you are not going to pinch many times. In this case, I prefer to use the cannula. Here is the technique, the needle. So I go directly perpendicularly, I touch the bone and inject. You can see when I inject, I use a color product. The color product is injected below the temporalis muscle. So when you inject the cannula, I inject the temporalis muscle. If you inject with the needle, you are close to the bone. It's not the same layer. So it is the result. You can see here when you feel this area, it's very important to create, like I told you before, a perfect curve between the forehead and the temporal area. And when you put your finger on the forehead and you go down, you absolutely have never to feel any depression. Even if you have a small depression, you have to feel it. It's very important because you remove the shape. If you remove the shape, you create beauty. So it's worth it. You see the eyes, with aging, you know the eyes can look like this. They come a little smaller, and the top of the county system is going down. And the lips, I spoke before about the lips, the same. So if you want to create a nice eyes, you have to go here. So you have to do everything you can in order to create this curve of the eye. So the problem is, if you look at guys very old, I mean 80 years old, they are the eyebrow like this, like a pig. Why is their hair like this? Because they always like this. They fight against the gravity. And because they fight against gravity, they always lift the eyebrow, and the eyebrow is like this. Because they fight against the gravity. Always are like this. Always. So what you have to understand, you have to create this curve of the eyebrow if you want to create beauty of the eyes. So I told you have to inject here fat or hyaluronic acid. You can do both. I love fat, of sure. I love fat because I wrote a book about fat grafting, so of course I love fat. But if you want to inject fat or hyaluronic acid, the procedure is the same. Only what it changes the size of the cannula. For the fat, you're always obliged to use a cannula of 21 gauge. So the procedure is easy. I will show you on the cadaver. And at the same time, I inject the patient. It's so important to remove the hole at the sliver. If you remove this hole at the sliver, you create really the beauty on the eye. It's very important. The problem is never a patient will tell you, doctor, I need to feel here. Never she will say that, but you have to tell her. And you can see after a massage, you have to inject deep. In the past, many years before, I used 30 gauge. Now I use only 25 gauge. You can see, I told you before, I tried the cadaver to injure the vessel and the nerve. With the needle is so easy to injure. With the cannula, I cannot. I mean, in this area, it's better to avoid the needle, much better. Use only cannula if you want to be safe. I'll show you again here. You can see the needle and the cannula. With the needle, it's easy to injure, very easy to perform events, very easy. With the cannula, I cannot. I tried many times, I couldn't. So it's very important to do that. So this is a patient, it's a doctor as well, or don't take a picture because she's